As long as mankind has conflicting views and the willingness to fight for those views or ideals, there will never be peace and war will continue to be part of mankind. Wargaming is meant to be a fun hobby, but there are drawbacks. War by no means should be glorified, but learning from it should be the goal of everyone. Many people today give little or no thought to this, as we are all concerned with our own comings and goings. It is the youth that get a strong dose of war in the games that they play and on the news that they see, but it is the soldiers returning home that suffer the most from war. Over time, mankind has grown less accustomed to violence in daily life. Many soldiers returning from conflicts suffer from post-traumatic stress disorder. This is the result of prolonged combat or being wounded in combat. In World War II, there were many cases of hysterical soldiers during and after combat. A myriad of symptoms from blindness to catatonia presented themselves. This was viewed as cowardice rather than stress in most cases. Studies on post-traumatic stress disorder didn't start till the late 1980s and have found that in the first two world wars, the rate of PTSD was much lower than from Vietnam War to present conflicts. Risk factors for soldiers who develop PTSD include general combat, being wounded, witnessing death, digging graves, and being captured or tortured. Higher rates of PTSD and depression are associated with longer deployments or multiple deployments. Good leadership, support from soldiers, and training can contribute to positive mental health and well-being during deployment and are protective factors that can reduce the risk of developing PTSD. Realizing that someone you know or yourself may have PTSD is the only way to ensure that they can get proper care. Post-traumatic stress disorder can also present symptoms long after the event or events took place. Screening for PTSD should be done at least once a year to see if soldiers are in need of care. A diagnosis of PTSD requires a comprehensive clinical evaluation performed by a psychologist, social worker, psychiatrist, or psychiatric nurse practitioner. Due to concerns that a diagnosis of PTSD may jeopardize their careers and difficulties getting to appointments with mental health care providers in combat zones, in addition, some mental health care providers lack the necessary training to treat PTSD and restrictions on medications that can be used by active duty soldiers. The military needs to build on current efforts in early identification of PTSD in soldiers and veterans who have PTSD by providing access to the best care as soon as symptoms appear. To that end, the military also needs to support research that investigates therapies and technology that may help to overcome obstacles to awareness, accessibility, and availability, and an adherence to treatments. Treatment for PTSD should be integrated into the treatment of the physical and mental health conditions affecting soldiers and veterans all over the world to promote a state of good mental health upon returning home from foreign conflicts.